morning, everyone, or good afternoon. We will be waiting a few minutes before we get started with the presentation. We just want to give everyone a chance to jump on, and maybe in about 3 to 4 minutes, we'll go ahead and we'll get started. Thank you so much. Aloha and welcome to today's online webinar, Accessing Services for Native Veterans. We're glad you could join us for today's session. We're going to go ahead and get started. Today's session is being presented by the Pacific Region Training and Technical Assistance Center, which is a resource of the U.S. Administration for Native Americans. My name is Shisa Kahanile, and we're excited to have you all join us for this special webinar focusing on helping our amazing veterans access services in their Native communities. ANA's mission statement is to promote self-sufficiency for Native Americans and Pacific Islanders by providing discretionary grant funding for community-based projects and training and technical assistance to eligible tribes and Native organizations. ANA's vision is that all Native communities are thriving. Before we begin today's session, today's opening remarks will be given by ANA Commissioner Jeannie Hovland. Jeannie Hovland is an enrolled member of the Flandreau-Santee tribe of South Dakota, and she is a commissioner of the Administration for Native Americans, an agency within the U.S. Department of Health and Human Services. She is also the Deputy Assistant Secretary for Native American Affairs. Hovland oversees ANA's discretionary funding programs to American Indians, Alaska Native, Native Hawaiians, and Pacific Islanders. She serves as an advocate for Native Americans and coordinates activities within the U.S. Department of Health and Human Services to develop policies, programs, and budgets affecting Native Americans, all under the authority of the Native American Programs Act. As Commissioner, Hovland serves in the dual role of the Deputy Assistant Secretary for Native American Affairs, affirming the government-to-government relationship between the Administration for Children and Families and Indian tribes. Since her confirmation in June 2018, she has visited with hundreds of tribal leaders and community members in dozens of Native communities for listening sessions and tribal visits. In August 2018, the Commissioner testified before the Senate Committee on Indian Affairs to advocate for Native American language preservation and maintenance, and again on February 27, 2019, to promote social and economic development in Native American communities. Hovland chairs several advisory councils, including the ACF Native American Affairs Advisory Council and the Secretary's HHS Intra-Departmental Council on Native American Affairs. She serves as an advisor to the Secretary and provides advice, opinions, and reviews policies affecting Native Americans while addressing issues of importance to tribal communities through partnership with all of the HHS operating and staffing divisions. Prior to her appointment, Hovland served as Senior Advisor to the Assistant Secretary for Indian Affairs at the Department of the Interior. Hovland has also served as the Tribal Affairs Advisor to Senator John Thune for more than 12 years. Hovland played a key role in advocating for legislation at the requests of Indian tribes on such issues as agriculture, services for law enforcement and veterans, and quality access to healthcare. She worked to develop legislation such as the Tribal Law and Order Act of 2010 and the Cold Talker Recognition Act of 2008. Prior to her time in public service, Hovland was CEO of Wanchee Native Nations Consultants, which offered training services and programs for tribal governments. Now we can introduce ANA Commissioner Jeannie Hovland.
Thank you, and Petuwashte Madakiapi. Good afternoon, my relatives. Chante Washte Nape Chusapi. I greet you with a good heart. This is Jeannie Hovland, Commissioner of the Administration for Native Americans. Welcome to today's webinar. I want to say thank you to our team and the Veterans Administration for setting up this webinar. And I want to say thank you to all on the line who are participating, and to those of you that are veterans, our Akichita Oyate, protector of our people. I say thank you for your service. Thank you to your families for the sacrifice they make and the support that they give to you so that you can serve our country. I really appreciate all of you and look forward to celebrating your service this Monday. A few things as Commissioner, it was mentioned by law, I am to be an effective and visible advocate for Native Americans, and I take this role very, very seriously, and I always want to make sure that veterans, Native veterans, are at the table when we're talking about policies and budgets. And at the Administration for Native Americans, we do have discretionary grants. One that is very flexible is the Social and Economic Development Strategies. This funding comes out in January, February this year, and I've really encouraged our tribal leaders to remember veterans as they develop projects in the Native communities and urban settings. So currently we do have one grant that is specific to Native veterans, and that's Trickster's Gallery out of Chicago, servicing the veterans and the population there and in their urban population, as well as tribes across the United States. And they host the largest annual veterans gathering every year. This was their third year, and I was able to participate. It's an amazing way to bring our veterans and our warriors from across the United States, Alaska, and the Pacific region together to learn of services, to have a community of visiting and veterans being able to have that peer-to-peer conversation. So it's fantastic. I know they're planning another event for next year, but really I want to take the opportunity to learn how I can be an effective advocate for you out in Washington, D.C. and throughout the Administration for Native Americans. So thank you for being part of today's webinar. I always make it a priority when I am in tribal communities to try to meet with elders and veterans and youth. So if you have a organization or if you have a large gathering that will be taking place of veterans, I would love to hear about it and be invited to attend. If you want to reach me, My email is ANA for Administration for Native Americans, so ANA Commissioner at acf.hhs.gov, and we can put that in the chat box and get you that information. But again, the more I know about ways that I can support you, the needs, the gaps in services, things that you see within the federal government that you feel are working well in our Native communities, it'd be great to hear your feedback and your input. Again, I value your voice. Thank you again for your service, and thank you for participating in today's webinar.
Thank you so much, Commissioner Hovland. We're so honored to have you join us for today's webinar, and mahalo for your time. So about today's panelists, we are so excited to introduce Jennifer Chowdhury, who will be talking to us about what is available for our Native veterans. Jenny obtained her master's degree from Case Western Reserve University in 2007, and her experiences as a social worker include inpatient psychiatric care, HIV/AIDS case management, intensive in-home family therapy, emergency department social work, both adults and children, child and adolescent therapy, residential drug and alcohol treatment, residential and outpatient PTSD treatment programs, intensive outpatient mental health working with severely mentally ill population, and the program manager for women's health and whole health programs. She's currently the Special Populations Program Manager at BISN 21, and Jenny is responsible for the whole health program, women's health program, ORH, IHS, HPDP, and MOVE. In this role, she oversees program development and efficient service delivery through these programs at all the facilities in BISN 21. Mahalo, Jenny, for taking the time today to teach us all about how our Native veterans can access these services available to them in their communities.
So my name is Jenny Childers, and I am the Special Populations Program Manager for VISN 21, which is basically the West Coast and Hawaii and Guam and the Philippines. And today I'm going to talk about some of the VA services that are available for Native Americans. So I wanted to start out by showing you a little bit of that catchment area, which shows all of our healthcare systems, which is VA Pacific Islands, VA Southern Nevada Healthcare System, which is affectionately known as Las Vegas, VA Sierra Nevada Healthcare System, which is Reno, VA Palo Alto Healthcare System, VA San Francisco Healthcare System, VA Central California Healthcare System, which is Fresno, and then VA Northern California Healthcare System, which is Sacramento. So you can see the map. We kind of cover that whole western coast, except for the little southern part of California. The next slide I wanted to show you is the area that Pacific Islands covers. So we have a major hospital in Honolulu, but they cover all the islands, Guam, the American Samoa, and some of those other islands out there. And so if you look at the catchment area for the Pacific Islands VA, it actually is a surface area that's larger than mainland United States. So it's a lot to cover, but they do a really good job at offering services at all the islands that they cover. So the first program I wanted to talk about is a kind of a new program, so if you haven't heard about it, I'm pretty excited about the opportunity to present this, but if you have, hopefully it's some new information. So the whole health program is VHA's strategic plan, which is to emphasize veterans and their families' whole health and wellness. A whole health system focuses not only on treatment, but also on self-empowerment, self-healing, self-care, and improvements in the social determinants of health. So this is really an exciting time for the VA, because this is kind of the first time in VA history that we've really focused a lot of our efforts on preventative care. And so you're going to see a lot of activities, and I'll go through some of the slides, but things like acupuncture and chiropractic services and things that we have tried to put in place that can help prevent long-term issues. So whole health is an approach to healthcare that empowers and equips people to take charge of their health and well-being and live their life to the fullest. And so this is their kind of mission statement. And so what they're talking about is the fact that we want veterans to be at the center of their healthcare. That all of these services come around the veteran, but the veteran also gets to drive those services. And so one of the examples I usually give is the idea that sometimes when you go in to see a provider, they'll just give you 5 or 6 or 7 or 10 medications. And so sometimes it's difficult for a patient to say, you know what, I don't want that medication. And so the whole health system is actually transforming that to give some of that power back to the patient to make those decisions for their health care. So if we go to the next slide, these are kind of the components of the whole health system. The reason they call it, you'll hear me interchange between whole health system and whole health program because it's easier to call it the whole health program. But really, it's a whole health system that incorporates the entire healthcare system. And so there are, as you see in the center, there's the personal health plan, which is the person in the middle. And then there's 3 different avenues in which the VA is focusing on. So the pathway, which is empowering partners with the veterans to discover their mission, aspiration, and purpose, and begins to create an overarching personal health plan. And so you guys might be asked questions like, well, what is your whole health goal? And we'll go through each of the circles of whole health, but we really want to know what your goal is for your health care. Instead of coming in and saying, oh, we see on your lab that you have diabetes, here's all the medication, and these are things you need to do. You might say, I don't want to work on my diabetes. I want to work on not smoking. And so we're really going back to finding out what you want in your own healthcare. Then there's the whole health clinical treatment, which is the inpatient and outpatient. So you should see this anywhere you go in the hospital setting. There's the health and disease management within a whole health paradigm. So we're talking about CIH, complementary integrated health options here, which I was explaining are acupuncture and chiropractor services. There's a ton of services involved in that, yoga, and I'll go through several examples. And then, of course, the well-being program. So this is self-care and skill building to help you reach those goals. So well-being is talking about the health coaching. So we've trained a lot of our folks to do health coaching with our veterans to say, you might come in and say, I don't know what my health goals are. And so that's their goal, is to help you figure out what your goals are. And then as you see, as you go out of that circle, you're in the middle of that. And then on the outside is the healing environment. And then, of course, your community and how that impacts your personal health plan. So in the next slide, we have just some examples of where we have different areas of, they call it the whole health activities. So if we look at our side of the world, we have quite a few of programs going, and we've been working with Office of Rural Health to get the whole health initiatives out into our rural parts. And one of the exciting things that I'll talk about later is utilizing telehealth and our VBC program to reach some of the Native American tribes. So the components of whole health orientation, you should be asked if you want to go to an orientation. Some facilities have attached the whole health orientation to the orientation classes to the VA that they were already doing and added the whole health components to that. Really what they're talking about in this class is just explaining what and why we're doing whole health. So the next component is whole health coaching. And in the whole health coaching, that's where you're going to be meeting with a peer, somebody else who's a veteran who has been trained to coach you along your personal goals. How do you fill out some of the paperwork? How do you talk to your providers? How do you access some of these resources? And then, of course, the clinical preventative intervention. So we talk about mindful awareness, work in the body, surroundings, personal development, food and drink, recharge, family, friends, and coworkers, spirit and soul, empower the mind. So if you look to the right, those are those little circles that kind of surround the person. So I'm going to go through each of those and give you a couple of examples. So for mindful awareness, I'm sure a lot of folks have heard of mindfulness. There's a great VA app that is free for mindfulness activities. But mindfulness awareness is paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So this is an informal type of intervention. And so you will see groups at the VA that are called mindfulness groups. They're called mantra groups. These are just different examples. There's some body scanning classes, and of course, meditation. So you usually see mindfulness groups or mindfulness that is incorporated into other groups. And so one of the examples I give is mindfulness is picking an object in the room and focusing on that one object and explaining it to me so that I know that you're right here, right in the moment and present. Meditation, on the other hand, is the act of closing your eyes and thinking of a place that makes you feel safe. A lot of times people pick the beach, so they'll talk about, the water coming in and taking over to kind of get rid of that stress. So two big differences, but very good interventions. So then on the right side, you see the working the body. This is pretty an active list of activities that VA offers, but there are a ton more throughout our whole system nationwide. So these are just examples. So we have adaptive cycling, golf clinics, bowling clinics, acupuncture and battlefield acupuncture, massage therapy, chiropractic services, equine therapy or animal-assisted therapy, yoga, tai chi. So we've seen these kind of pop up through our recreational therapy programs. And so some folks may know that, oh yeah, they have a yoga class, or they might have a Tai Chi class over at the rec therapy hall. And so what they've done is kind of put these all under one category. So it's a very limited list, but there are plenty of different opportunities to this realm of someone's life of working the body. In the next slide, we're going to talk about surroundings. So kind of the definition of when I think about my whole health, what is involved in surroundings? So it involves everything around you that can affect your health and your well-being. So your home, your workplace, your neighborhood, experiences that affect your emotions, climate and the weather or the environment. So an example here is sometimes, so I actually live in Las Vegas and I get to use this example. We've had numerous people move out here and they have, I guess, no idea that it's a desert and it's very hot here. And so they might last here for 6 months and then realize, well, this is not for me. And so they end up leaving. And so sometimes it's very important to understand what your environment is or your climate and how that really impacts your health. Another example would be perhaps your workplace. So maybe you work at a place, we have a clinic here that for some reason it's brand new and they decided to decorate it with brown and orange, which is very outdated, but that's what they decided to do. And so when you go in the building, it's kind of depressing right when you walk in. And so sometimes your workplace, even a paint color can change your attitude or your mood. And so we want people to be aware of their surroundings and how that might be impacting their whole health. If you are a very active person and you're not able to go outside and do activities, maybe you live in Alaska, I don't know. But you live in Alaska and you're not able to do those things, that maybe the environment is having some impact on your surroundings. So when we move into the next circle, it is what is personal development? So personal development is a part of the circle of health that focuses on different ways you can grow in different areas of your life. So a lot of times when I'm working with veterans, I will ask them, what are you doing to work on yourself? A lot of times they're like, what are you talking about? So we always talk about what are your goals for personal development. A lot of our folks like to go back to school once they're out of the military. They want to be able to enhance their life somehow through being able to have these goals in their personal development. So some examples through VHA are happiness boot camp groups, which is a funny group because everybody knows that being happy is sometimes hard all the time. Of course, we have Voc Rehab, which offers a lot of opportunities and resources for education. Another example might be an assertiveness group. It might be saying, hey, I know that I get bullied all the time because I don't ever stand up for myself. So the VA is trying to help our veterans learn how to be assertive and not aggressive or not passive. And self-esteem groups, which helps in all areas of your life, whether that's at home, at work, or in the community. And then another example might be a budgeting class, or how to save money, or how to pay off credit cards, those kinds of classes. So those are just a few examples for personal development. So another big one is food and drink. And some of these programs you guys have probably heard about if you've been in the VA. And I'm sure that this is really big in mainstream media right now, but making healthy choices about what you eat and drink is a powerful way to help care for yourself. So they always say what you put in is what you get out. And so that's been out there for quite some time. And so VA is really working on how to help our veterans be able to make the right choices, but to be able to, maybe substitute things that you use every day with something that might be healthier. For example, if you use salt every day, maybe you're going to substitute that with Mrs. Dash or something like that, so that they're not massive changes, because most people don't like to subscribe to massive changes. But if we could change one little thing in your diet, it has a lasting impact. So some of the things that we have, and some of these are actually online if they're not offered at your clinics or VA, or Healthy Teaching Kitchens. Chicago actually has them online. And what they do is a dietitian will actually do a cooking demonstration. And an example would be instead of, they cook chickpeas, and then instead of using salt, they actually give the group of veterans like 5 or 6 different spices to try on the chickpeas instead of salt. And so it's just a different way to help our veterans learn that there are other alternatives for a healthier lifestyle. And of course, the big program that we have is Move. Move, I always call it, I'm joking, but I always call it false advertisement, because we don't actually move in the program. They actually focus on, again, your diet and what you're putting in and how that impacts your energy levels and the other aspects of food. And then some facilities have veteran healing gardens. They might have a farmer's market. They have opportunities to grow their own gardens, some of their fruits and vegetables. The VA facility has, or the clinics have some space. A lot of our facilities don't have space for those, but they've been able to work with the community to do community gardens. So it's really exciting. We want to be able to expose our veterans and give them opportunity to get as much as possible fresh fruits and vegetables. So that's where that's coming from. So another circle is the recharge circle. And what does it mean to recharge for whole health? It refers to sleep, rest, and relaxation, which gives you energy. And if I was in the room, I would ask how many of you guys got 8 hours of sleep last night? And I doubt most people would raise their hand. It's just something that we are not very good at doing. We oftentimes sacrifice sleep for other chores or other issues going on. And so it's one of the easiest ways to start out with a fresh mind. But oftentimes we neglect this part of our health. So some of the things that we have in the VA are some CBTIs, counseling for insomnia. We might do some aromatherapy. I know some VAs up in Washington and Portland are doing some aromatherapy with these tabs that you can pin on your shirt for about a week. And so that helps folks relax. And so the other thing that we talk about is how can we help you have healthy sleep habits? And one of the things is an easy example is that we shouldn't have electronics in your bedroom. When you go to bed, that's what you should be doing in your bedroom, is sleeping. And so the more electronics we have in our bedroom, the less likely we are to get great sleep. And so those are the things that we talk about in the recharge circle. Is those folks oftentimes who come in I think if you looked at the gamut of our veterans, probably most of them have issues with sleep, whether they can't fall asleep or stay asleep. And so instead of always jumping to a medication, maybe you look at going back to another circle, their surroundings. Maybe they are facing the wrong direction and the sunlight hits them at the wrong time, or some of those things. But how can we help you look at your environment and some other holistic opportunities to help you with sleep? So in the next one, so we have connecting for whole health. So this is a really big one, and there's some examples that I'll talk about. But one of the other things that whole health is working with is actually our suicide prevention model, and this is really the circle that hits home with that, and it's that connectedness. We all know that it takes just a minute to realize how relationships can affect our emotional, mental, and physical health. And it's very difficult sometimes for our veterans to feel connected, which is why we have a lot of folks who might just come and hang out at the VA or at the clinics. They want to hang out with people that have like backgrounds. And so being able to connect with other people is vital to whole health and being able to have those relationships. And so oftentimes we have veterans that come in, and as a VA employee, we might be the only contact that they have. And a lot of our folks may not realize that. And so being able to work with social workers at the facilities or at the CBOX is a really big opportunity to figure out how we can get veterans connected to other veterans or to other groups. So some examples are the bowling leagues that we have, again, animal-assisted therapy, support groups, and of course, always encourage volunteer work. Being able to get out and to give back always helps with that feeling of connectedness. And then last but not least is the spirit and soul. Research has found that religion and spirituality may affect a range of health issues. And so I always give this example as all of our veterans have experienced or at least know of a chaplain. All branches of the military have them. And so this is potentially not a foreign concept to them. So some examples of in the VHA that we have are, of course, our chaplain services, maybe Reiki, Qigong, yoga, Tai Chi. And then there's this kind of acronym that says I am secure. So what is the impact of military service? What is the approach to your spirituality in medical settings? What is the meaning in life? What is spirituality defined? What is the source of peace? Community, there's that community piece, connecting to your community. And then understanding of why this is happening. And then rituals, practices, ceremonies, and of course, end of life. So these are some of the questions, if you were to talk to chaplain services, that they might start asking, because this is a whole health component to chaplain services. And so being able to actually ask the veteran what they think of spirituality and getting that into the documents instead of saying, oh, well, you're this religion or you have this background, and then trying to help the veteran have whole health goals that incorporate that. So those are the 8 kind of aspects of whole health. We are very excited because in Vision 21, all of our facilities have a whole health program and whole health points of contact. And so we are working very diligently in the Pacific Islands to ensure that all the islands have access to these services as well. And so, for example, there's a provider in the American Samoas who is actually certified in battlefield acupuncture and performs that. So we continue to work with our telehealth programs to ensure that we can get some of these programs out there. So it's exciting. So the next program I'm going to talk about is our Women's Health Program. And again, we're very excited that we do such a great job, I think, taking care of our women veterans. It appears as though it might be a small population, and it's probably about, maybe in the late 90s, it was a pretty tiny population. I think it was estimated that 2% of our veterans were women. In 2019, we are up to almost 19% of the population. And so it's a huge jump. And so we are doing everything that we can to ensure that our women veterans are getting the same care that our male veterans are getting. So if you look at the next slide, I just put this in there to kind of show you the idea that the overall population of veterans is actually decreasing, but the pocket of women veterans is increasing. So we have more and more women serving, which means we're going to have more and more women veterans. And of course, a lot of them are a little bit younger, so we're having some new issues present to the VA that we haven't addressed in the 80s and 90s, which is the maternity care, child care issues. And so the VA is diligently working on those unique situations for our veterans to ensure that they have the access to care when they come in. For example, is not having child care a barrier to coming into your medical appointments. And so we found that oftentimes it can be. And so how do we address that from the VA? So if we go to the next slide, some of the things that we know as the younger veterans are coming in is they want flexible appointments. Everything's on their phone. They want to be able to come in the afternoons or late evenings or on the weekends because they oftentimes work. And so we want to make sure that we're being able to meet those needs. And one of the ways that we're doing that is through telehealth. And so we also offer afternoon, evening appointments and Saturday appointments at most of our facilities. So that came from the request from our field. So the next big one that we are working on that we know that they need is childcare. And it's become a little bit of a legal issue, but we are working very hard to figure out how to eliminate that barrier so that women veterans and our male veterans feel like they can come in to appointments even if they have kids and they don't have anybody to take care of them while they're at an appointment. So more to come on that one. There's some legislation out there right now for it. So the next one is reproductive health. So again, you talk about the maternity care. So we're looking at these veterans, women veterans who are coming in at 25 to 30-year-olds who are talking about having babies or having babies. And so we want to make sure that we have top-of-the-line interventions and knowledge on the reproductive system and reproductive health. One of the ways that we did that was, I'm not sure if I put this in here, but a couple of years ago, VA passed the IVF and adoption services bill, which allows veterans to get IVF treatment paid for by the VA if they meet certain criteria. And so that's a huge step in the right direction to make sure that we're meeting these needs. Another issue that we've been addressing is the military sexual trauma. And then, of course, with our younger folks, actually across all age spectrums is acute and chronic illnesses. One of the things that we teach in our training for women's health is a lot of our folks come back from being deployed and they're presenting with high rates of pain that are not the same that our civilian folks of the same age would have. And so having to be able to have the background knowledge of what our veterans have gone through overseas, as simple as having to carry our women veterans carrying the backpacks that are made for men. And so you might have a 6'4" gentleman carrying the pack, but then you have a 5-foot female carrying the same size pack. And so what does that do on the frame of the body? And so we do a lot of research and education around those specific things so that when a female veteran comes in, the providers know, oh, she's just not making that up. We know that there's a reason why they have some of these complaints. The next one, of course, is the preventative care. I talked about that a lot earlier about whole health and how we're trying to get ahead of the curve. Instead of waiting for people to get sick, we're going to teach you how to be healthy so that hopefully you don't get sick. An example might be diabetes. Can we teach you how to eat healthier? Can we teach you some other lifestyle skills so that potentially you don't get diabetes? And of course, we have our older folks are getting into the menopause. phase. So we offer menopause interventions, hormone replacement, those kinds of interventions and the knowledge. And then, of course, the same thing comes up again, right? So acute and chronic illnesses, they may be the same, but a lot of them might be different as they get older, or they've been deployed and they come back, and a couple of years later, they might realize that they have some symptoms that nobody else in their family has. And so we teach our providers to address those. And then, of course, mental health needs. And then if we go to the next slide, our older population of veterans, of course, we've been focusing on our geriatric care, being able to create medical foster homes, those kinds of programs so that we can take care of our folks even as they get older. Again, pain management. Several of our VAs have their own pain departments now. And of course, incorporated in that is not just pain medicine, but it's the chiropractors, the acupuncture, the alternatives to medicine that our women veterans and our other veterans have said that they want in. And then, of course, inpatient and extended care, grief counseling, and then there it is again, the acute and chronic illness. So we were looking at the entire lifespan almost now of our veterans. So we get them in as young as 20 probably, and then of course all the way through the rest of their lives. And so we have had a interesting learning curve as we start to learn these other areas for women's health needs. So what does Women's Health Services do? So they actually offer comprehensive women's health care, which includes breast care. So we offer mammograms at all of our facilities or in the community. We offer contraception. There's eating disorder interventions. We have several eating disorder teams throughout the nation that will address those issues. We have emergency services, not just emergency medical, but also emergency GYN to address specifically for our women veterans. We have mental health and homelessness interventions, infertility and IVF, intimate partner violence services, which is kind of a new thing. It's not new, we just kind of named it something different. So it's in line with our domestic violence. And so we have intimate partner violence coordinators at all of our facilities. And so if that is an issue, you can always direct them to that person and they will give them the resources that they need. And then, of course, maternity and newborn care, and then geriatric care. So if we go to the next one, so telehealth and VBC, if you're not familiar, VBC is video connect, via video connect. And so there's kind of two different ways to get to the same needs. One of them has you come into potentially a CBOC, or we're actually working with some of our locations to put a telehealth pod so that you do not have to come into a VA facility. So we're talking with Northern California tribes potentially to have a hub or a pod out there so that the veterans don't actually have to come into a CBOC. The other places that we've talked with, and there's one going into a VFW. And so we're looking at community places that veterans already frequent so that they can access the care that they need without having to come all the way in. So what is telehealth and VBC? It's a video conferencing tool. It's web-based, secure and simple, connects provider and veteran any device, any location. One of the exciting things is that so telehealth kind of has you come into a central location, or you would have to have a computer desktop. VBC is very different on the aspect is that we can use your cell phone. So you're on your cell phone, the provider is at their desk, and we can connect you that way. And so it's easier to access care that way if you're not able to get out of your house, or it's 5 hours to a VA, et cetera. So VA Video Connect is a VA application that enables veterans to virtually meet up with their VA healthcare providers in something called a virtual medical room, using encrypted video to ensure that the clinical video session is secure and private, and that it allows veterans to see and talk to their healthcare providers or teams from anywhere. So I think there was a commercial for BBC from T-Mobile, because I think that's who is one of the big providers. And so that was actually out on national TV, I want to say around the Super Bowl time. So I don't know if you've seen that. So it's a very easy tool, and it's meant to be very secure so that our veterans' healthcare or health information is private, but that you are at the forefront of your appointment. So we go to the next slide. This is just a little bit of a diagram of how does it work. So we schedule the appointment on our side, the VA Video Connect visit. You get sent an email. You open and click on the link that's in there. And then once you click on the link, it'll say, do you want to join the virtual medical room? And that's essentially how easy it is. So VA Video Connect is very easy, it's very user-friendly. And we actually have, if it is something that is a little bit difficult, we have folks that can train both, obviously, the providers that are veterans on how to use it. We'll help you set up your phone. We actually will do a test visit with you just so that you can see what it looks like. And it makes it so much easier because you may not just be able to get in or be able to access some of those services, or you might have to work. So if you're working and you only have an hour for lunch, you're not going to be able to drive into a clinic and get back and see the provider. So it's very veteran focused. So I'll give you a picture of the sample email. So this is kind of what you guys would get, a veteran would get with the link in it. And so once you click on it, the link goes to, if you go to the next slide. So once you've entered the virtual medical room, this is what it'll look like. So the appearance may vary, of course, upon your device, whether you're using an iPhone or an Android. But in the right corner, you can see a picture of yourself using the room. And then you can use the self-view to ensure you're well positioned for the camera. And then, of course, making sure that there's nothing crazy in the background. And then there's some other things. So you'll see kind of how you can, there might be, one of the things that we are working on in Vision 21 is doing group appointments this way, so that we can potentially do a yoga class or some of these other things via VVC, so people can do these groups while they're at home. So if you look in the left corner, and this is what our veterans always want to know, who's in the room with you in the quote-unquote virtual medical room, and so it'll show you who's there. You don't have to worry that other people are listening or that anybody else is in there that you don't know. So I think that's I think it's a great way to ensure your privacy. So, that should be it for VDC. This is something that we are really trying to use, especially in the VA Pacific Islands, for those facilities that we can't actually get out to, or we're having a really difficult time getting specific providers out to those clinics. We have several grants through Office of Rural Health to provide telehealth primary care, telehealth mental health, and some more telehealth programs, so that we have services for all of our veterans, no matter where you live. And then lastly, the program I really wanted to talk about is the NABL program. So since 1992, the Native American Veteran Direct Loan Program has provided eligible Native American veterans and their spouses the opportunity to use their Department of Veterans Affairs home loan guaranteed benefit on federal trust land. So VA provides direct home loans to eligible Native American veterans to finance the purchase of, the construction of, or the improvement of homes on federal trust land, or to refinance a prior loan that they had. And of course, this is through your VBA office, the Veterans Benefits Office. And so we're very excited to report that at the end of fiscal year 19, 202 active NABLs on Hawaii homelands. And so you guys have the most in Hawaii, has the most in the whole program. And so we know that those folks are utilizing that service. And so we would love to see more and more folks use it, because it's a benefit that you guys get. So I just put the information for you to contact the program if you wanted to. There's a loan specialist that's actually located in Honolulu, but the region office is in Phoenix. So if you have any questions, you can always contact the VA Office of Tribal Government Relations, or you can contact, every facility has a minority veterans coordinator, and these folks can help you navigate the VA system, help you get resources, and so it's an easy resource to reach out to if you just don't know where to start. I would go in and ask for the minority veteran coordinator. So other than that, I've left my contact information. If you have any questions or comments or just want some more information, please don't hesitate to reach out to me, and I will get you either information or a contact person. And again, I just wanted to remind you that all of these services, I talk a lot about Vision 21 and what we offer, but all of these programs are available throughout the entire nation. And so we don't have these programs I specifically talked about are available everywhere, so you can access them anywhere that there's a VA. Mahalo. Thank you guys for your time.
Thank you so much, Jenny and Commissioner Hovland, for joining us today. That will conclude our webinar. You folks will be getting an email with being sent to the email that you registered this webinar with. And in that, we're going to include all the information that you saw today. And later this week, we'll have the actual recording available on all of the ANA regional TTA centers, all of our websites, as well as the ANA website. So we'll go ahead and we'll send a link to that as well once it's available. If you have any questions, please feel free to either contact the contacts that were left by Jenny, or you can go ahead and email the GoToWebinar email that you guys received as a reminder. Thank you so much for joining us. We are excited to have put on a webinar that is specifically for our Native veterans, and all of the available programs that we have on top, that they have on top of anything else you can find on the website. Again, if you have any questions, go ahead and email Jenny or reply back to your reminder email, and have a great day. Thank you so much. Aloha.